Hello, how are you?
Very well, thank you. Now, where are you from?
I'm actually located in DC, so that's where we're filming from too.
Oh, great. That's convenient. So please tell me a little bit about yourself.
Sure. So I'm actually originally from New York, moved to the DC area after I started practice, and am currently the director of the Medstar Georgetown Headache Center right here in Washington, DC.
Now, what is your title?
Director of the Headache Center at Medstar Georgetown
Okay.
Hospital.
Now, I'm sorry, what is the difference between a headache and a migraine?
So the difference between a headache and a migraine are the symptoms that come in between. So you can get mild to moderate pain with just a regular routine headache. We've all had those before. But with migraine, the pain is usually more moderate to severe. Over-the-counter medications, they might take the edge off, but they're not really getting rid of the headache itself. And then with the headache, you get those other symptoms. Light sound sensitivity, stomach upset, vomiting. You want to be in a dark, quiet area. Movement makes the pain a lot worse. That's really the difference between a regular old headache that we all get and a migraine headache.
Now, who gets migraines?
So migraines can happen to just about anyone at any time in their life, but they're more common in women compared to men. When you look at childhood, though, they're more common in boys compared to girls. And we think this has a lot to do with hormone fluctuations. As we get older and we hit our first period, our hormones change, and that actually makes it more likely for us to get migraine headaches. As we get older and our hormones change again, we can actually stop or reduce having migraines once we're fully in menopause. So there's a lot of hormone fluctuation that plays a role in migraines.
Now, what is chronic migraine?
So chronic migraine is when you're having headaches more than half the month, at least 15 days a month of headache, and at least 8 of those are more moderate to severe with other symptoms of migraine, like that light sound sensitivity, stomach upset. So these are people that are living with pain more often than not and can be very disabled from having them.
Now, what are some treatments that can help people battle migraines?
So there's a variety of treatments available to help with migraines. There's things you can take as needed, called acute medications. When you start to have the migraine itself, you take these medications within the first hour or two, and they can improve or get rid of the headache within a 2-hour window. If you're having migraines more than once a week, you might want to start to consider being on a preventive medicine. That's something that's given to you every day to try to reduce the frequency of migraines. These are things that are often prescribed to you by your healthcare provider. When you're getting headaches more than half the month or chronic migraine, you might be wanting to consider what's currently the only FDA option for treatment, which is Botox. Botox is given as a series of injections by your healthcare provider every 3 months to try to reduce the frequency of headaches by 8 to 9 days less per month over time.
Now, what are some questions people should ask their doctor if they think they might have migraines?
And that's a great question. It's why I'm here today, teaming up with Allergan to bring you all more information about how to talk to your healthcare provider about your migraines. First, it's a great idea to keep a calendar at home. Mark down any day that you get a headache of any kind. Mark down the kinds of medications that you took for the headache and if they helped or didn't help. The next thing to do is mark down anything that might be a trigger. Things that you might have done that you noticed set off the headache from happening. You drank alcohol, you didn't sleep enough at night, you got your period, it's raining outside, your boss yelled at you, you had to give a big presentation at work, or you went on vacation. You got back from vacation. These kinds of differences in your life can definitely trigger the onset of migraine symptoms. And so it's important to know what those triggers are to help work on managing some of the lifestyle changes that can help with your migraines.
Now, what advice do you have to someone who's been diagnosed with chronic migraines?
So my advice is to stand up to your headaches. You're not alone. There are 3.2 million people in the U.S. with chronic migraine, yet more than 80% go undiagnosed. So speak to your healthcare provider. Start with your primary care doctor. Bring them the information I just talked to you about that you wrote down in advance, and have an open dialogue discussion about your symptoms. If you feel like you're not getting better, think about seeing a specialist, a headache specialist. This is somebody who's specially trained and certified to take care of patients with migraine and chronic migraine. Their entire practice will revolve around patients like you, so they're going to be able to talk to you about the new advances in treatment, what's down the line, what other things you can try that you haven't tried before.
Where can people get more information?
So a great place to go for more information is BotoxChronicMigraine.com. You can enter in where you live and find a headache specialist by you. You can also get a lot of great pointers on how to talk to your healthcare provider about your migraines.
Now, with this Botox, it's the same Botox people use to get rid of their wrinkles?
It is
correct?
the same Botox, but it's given in a different pattern. We're injecting in 7 different muscle groups throughout the head. So in your forehead, temples, back of the head, upper portion of your neck, and into your shoulders, as opposed to just a couple in your forehead itself for your wrinkles.
Does it still have the same effect in the forehead area too, or does it not?
It can depending on where your wrinkles are in your forehead. Some people get wrinkles in this area and it won't really affect that region because the injections are centered right in the front and right on the top of the forehead here.
Is there anything you'd like to add?
So I think that it's wonderful that we're talking about migraine today. I think it's important you realize that you're not alone if you're suffering. There's things you can do, there's things you can take to reduce the frequency of your headaches. So it's important to stand up and to talk about your migraines and to go to your healthcare provider and make that appointment to get yourself getting better so you can get back to living your life.
Those are some great tips. Thank you very much.
Thank you so much. Have a good rest of your day.